Welcome to Fields of Study from the Masonic Cancer Center. Today, we sit down with Dr. Dana Carroll. Hello and welcome. My name is Max Huber. I'm the Communications and Marketing Manager with the Masonic Cancer Center, and we are taking a little bit of time here to introduce and get to know some of our research members with the Masonic Cancer Center. And I am joined today by Dr. Dana Carroll. Dana, thank you so much for joining us.
Hi, thanks for having me, Max. This is great.
Tell me, before we get into like what your research is and kind of what you're doing on a day-to-day basis, tell me how we got here. What's the background story on who Dr. Carroll is?
Yeah, no, that's a great question. So I'm an epidemiologist by training, and I grew up in Ohio. Went to Ohio State, was a fourth generation Buckeye. So that's I come from a big Buckeye family. And then I did after I graduated from Ohio State, I went into public health and was really intrigued about the potential to contribute to prevention as a tool. And so after graduating with my master's in public health, I went out to Oklahoma to assist with the Stevenson Cancer Center's tobacco control, and essentially got my degree in epidemiology and then came to Minnesota to work with the tobacco research programs in 2017.
Well, what's your role with the School of Public Health?
Yeah, since November, so only about 6 months, I've been an assistant professor. And so I am in a position that's primarily research. I am also affiliated with the Cancer Center and specifically the tobacco research programs. And my research largely takes on kind of two different areas. One is community based research. So I do some work with particularly the American Indian communities in Minnesota to help reduce commercial tobacco use. And then the other area of expertise that I have is in tobacco regulatory science. So, how we can inform the US FDA, who regulates tobacco products, on ways to reduce the public health impact of tobacco products. And one particular area is how to reduce the addictiveness and appeal of commercial cigarettes.
Public health is a very broad science. What drew you to tobacco and the community health aspect around that?
Yeah, I think essentially during my master's program, I started to understand the gravity of how tobacco contributes. It's the leading preventable cause of disease and death in the United States and in many countries. And I was particularly focused during my master's on chronic obstructive pulmonary disorder. And smoking cessation is the best way to improve outcomes in patients with chronic obstructive pulmonary disorder. And so I started to look into more so the role of smoking, and it really just opened up how smoking can impact so many different people, so many families, either through smoking itself or secondhand smoke exposure. And given that it is still to this day the leading preventive cause of disease and death, I knew that through tobacco control and prevention efforts, I could hopefully make some impact.
We have a rich history of tobacco research at the University of Minnesota. Is that one of the things that attracted you to come here from Oklahoma?
Absolutely. So, like you said, the University of Minnesota and Masonic Cancer Center has the tobacco research programs directed by Dorothy Hatsukami. And there is really a multidisciplinary team of experts ranging from psychiatrists to biochemists to folks in health communication. And I was really intrigued about the potential to learn, but also work with these amazing team members. And so that was one important reason that I came to Minnesota. But the other is I was really interested in helping the communities that are most impacted by tobacco. And during my time in Oklahoma, I had the opportunity to work with the American Indian community in Oklahoma City. And there was a study that Dorothy and others at the Masonic Cancer Center had just started with an American Indian tribe in Minnesota to look at susceptibility to smoking and lung cancer. And so it was a perfect opportunity for me to continue my work in that area and to further help reduce the tobacco disparities that are experienced in the American Indian population.
Speaking of the American Indian population, tobacco can sometimes be seen as a ritualistic or traditional practice for them. So, how do you balance that fine line between big tobacco and the ritualistic nature of it?
Yeah, you're absolutely right. So for centuries, tobacco has had a sacred role for many American Indian tribes. And it is believed to be from the creator. It's often used in prayer and offerings. And so just simply making the distinction between when we're talking about commercial tobacco, saying, look, this is tobacco that was manufactured by big tobacco companies. It has been created to be very addictive. This is very different than traditional tobacco and how tobacco has historically been used by many tribes for medicine and spiritual healing. And so, as I'm learning in my work, what we are and what the tribes have been doing for on their own is using their culture to help reduce the burden due to commercial tobacco use. So, how can we reframe what we think of tobacco? And so, getting away from the abusive, addictive use of tobacco, but placing our emphasis on how it can be used in a way that's sacred and can be used medicinally.
And kind of flipping the switch here and going towards more of the metro regions like Minneapolis, St. Paul here in Minnesota. What are your thoughts on some of the bans that they've had? You know, making it so you have to be a certain age, restricting menthol cigarettes. I feel like this is making a good step forward. It's not where we need to be, but it's trying to get it out of the hands of people that are more maybe susceptible to start at a younger age.
Yeah, absolutely. So it's wonderful. Actually, nationwide now, the age to purchase tobacco has increased to 21. And that will hopefully be very helpful because what we see is that most smokers start smoking before the age of 18. And in high school, you have some 18-year-olds that can purchase tobacco for the
Yeah.
younger students. And so pushing that age to 21 will help in reducing youth initiation, which is really great. So, with menthol use, we've seen historically that there are some health disparity populations that have higher use of menthol in cigarettes, and that's African Americans. And so, it's great to see a ban on menthol in efforts to help reduce these health disparities and hopefully lower the prevalence of smoking among African Americans.
That's great. We're going to shift gears again. On a personal note, you know, you graduated from Oklahoma State, the Health Sciences Center in 2017, and now you've made the
University of
transition.
Oklahoma, but yes,
Well, did I say did I say Oklahoma State? Oh my goodness.
yes. Okay.
Oh, boomer,
It's in Stillwater, a couple hours away from Oklahoma. So
boomer sooner. Sorry,
there you
I
go.
screwed that one up. But you graduated from the University of Oklahoma Health Sciences Center in 2017, and now you've made the transition to full time working as a doctor. How has that transition been from hardcore work, doing your studies, working towards this goal, to now becoming a PhD and a researcher in the tobacco field?
That's a great question, Max. I think the biggest thing for me is knowing that I potentially, in a certain content area, am the expert, and that I need to be confident in my ability to contribute my perspective, my area of expertise. And so just taking more of the role of providing input, taking initiative has been a transition. Whereas as a student, you're often in that trainee mindset, kind of looking to others to guide you. But now that I'm a faculty member, it's really, I have a great mentoring team that helps move me. But at the end of the day, I'm having to make some of the big decisions.
As you can see, we are in a physical distancing state with coronavirus and COVID-19. How has your work changed from when we started 2020 to where we are today, beginning of April, where you're primarily probably working from home.
Yes, yeah, I have been working from home for the past 3 weeks. And on a personal note, obviously, there's no in person interactions. And I've learned that I really enjoy meeting with my colleagues in person and spending time with them. So I've had to kind of focus how I go about my day to day interactions. And thankfully, we have these wonderful platforms like Zoom, but it still is not the same as being in person. Regarding my research, several of the studies I'm involved with are primary data collection among human subjects. And so we have people come into the clinic or out in the community and we're interacting with folks. And so all of those studies have essentially been shut down. And that is unfortunate, but it's what we need to be doing right now to reduce COVID transmission. And so, actually, because of that, what I've been trying to focus on is getting my backlog of papers and some of the grants that I'm planning to write. I've been starting to get ahead on those. And also, there are some opportunities as an epidemiologist for secondary data analysis for me to be doing on looking at tobacco use prevalence through these big surveys. And so I've been doing some of that work. Another avenue that I'm pursuing is using online panels for studies. And so we're not able to get some of the data, such as biological samples that we would get among uh, participants in a clinic, but we are able to use these platforms to look at perceptions and barriers. Um, and specifically, I have a study that's looking at different messaging on a product standard in cigarettes and how people would perceive that. So there are some really interesting ways around the this outbreak and to continue being productive, and they're exciting to kind of to learn about.
It's interesting to see how people have transitioned and just to kind of adapted to how things have changed in the last few weeks. Um, Speaking of change, on a personal level, you went from Ohio to Oklahoma to Minnesota, and you've survived a winter here. How has that been, just personally? Moving around the country, going from, like I said, two O states to good old Minnesota.
Yeah, I've really enjoyed it. As part of my research, I really enjoy learning about communities and cultures and learning from people and who they are and what makes them Minnesotan or an Oklahoman, for example. And so I really enjoyed living in each of the different states as far as getting to know the culture and the people. I will have to say it has been kind of this enormous swing for weather. Oklahoma can be quite hot. It also has some pretty interesting winters with ice storms. And then coming up to Minnesota with the cold has been kind of this other experience. But I'm surviving and enjoying it. So, and it's a lot sunnier in Minnesota than where I'm at from Ohio. So I'll take what I can get.
Yeah, let's the sun looks like it's gonna peak out, so hopefully we can get outside
Yeah.
today. And then my last question is, with all the research you're doing and the team that you're on, what gives you hope?
That's a great question, Max. What gives me hope is working with the communities that I have the opportunity to work with and seeing that we can use their knowledge, their cultural practices, that they have the expertise to be the major player in solving their own health problems. And so it's exciting for me to work with these communities, for them to be empowered and to start to see how they react to the research findings. And that helps to start to move the needle as far as reducing tobacco use and cancer in the communities. So I would say, to sum that up, the communities I work with give me a lot of hope.
That's awesome. Well, we are hopeful that you are able to continue your in-person research soon. We hope that things go for the better, but we are all very proud of the work that you're doing, and we're excited to see where things go in the near future.
Thanks, Max.
Yes, thank you, Dana. Have a great day, ladies and gentlemen. Once again, this is Dr. Dana Carroll with the School of Public Health and the Masonic Cancer Center. We hope you have a great day.